My name is Dalton Wiggins. I'm the massage therapist here at Physical Medicine Center. Our address is 1 Elizabeth Place. We're located in Building A, and we're going to take you inside on a tour of our office. And this is our marketer, Daniella. We also offer valet parking as well as home pickup.
Me llamo Daniela Scotto, trabajo para Physical Medical Center y soy la traductora.
From the lobby, our treatment facility is actually roughly 10 steps from the entrance door.
Aquí estamos en el lobby y si pueden ver no estamos tan lejos de la clínica, está como a 10 pies del desk.
Pain is not a lifestyle, so 10 feet from the door, your treatment is accessible in Suite 1100B. If we step inside, I'm going to show you a few of the therapeutic exercises and treatments that we go through.
Estamos aquí, este es donde está la oficina. Si pueden ver aquí el número de suite es 1100B y vamos a entrar para enseñarles más de lo que tenemos adentro.
At reception here at Physical Medicine Center, you'll run into our lovely Michelle here. Very helpful with anything you may need to find.
Y si entran adentro de la oficina, está la recepcionista Michelle.
Would you like to say hi, Michelle?
Hello!
Okay, and we also, here's Dr. Amer.
Hello guys.
Y tenemos al Dr. Amer ahí atrás.
Welcome to my office.
Okay, from there. So, for your short wait, you'll have access to fresh baked cookies along with coffee, tea, and hot chocolate.
Y en lo que están esperando para ser atendidos tenemos galletas, bebidas, café, lo que gusten.
This is Jennifer, our trusty massage therapist.
Hello. Ella es Jennifer, es la masajista.
Physical Medicine Center at St. Elizabeth also offers a customized massage. Now, this means you're not going to get the same massage as someone whose neck hurts if your lower back hurts. You're not going to get the same massage as someone with a bad knee if you have a bad mid-back. So, you're going to be brought in here by me. I'm the massage therapist. And we're going to work on that specific area. I'm going to tell you how to lessen your pain throughout the day, and of course hydration at our wonderful water filtration system. Okay. Here at Physical Medicine Center, from the lobby to the chiropractic office, we're always working to make you better. So when you're waiting in the lobby, having a cookie and a coffee, you'll be sitting on these pads, and we're going to have you kind of shift your weight back and forth. This helps to open up the muscles in your back and in your hips, so we're going to be able to adjust you better. One of the newer additions we have here at Physical Medicine Center at St. Elizabeth's is our state-of-the-art water filtration system. So it doesn't filter your water one time, it doesn't filter your water 2 times, it filters your water 3 times through reverse osmosis and infrared filtration. Now that's what I call clean water. So we're going to lead you back over here to our beverage center. We have dark roast, light roast, and medium roast. We also have hot chocolate. And you can make your own latte here, okay? Here at Physical Medicine Center at St. Elizabeth's, we offer a orthopedic scanning machine, okay? So this is gonna decide which of your feet have too low of an arch, how low your arch is exaggerated, and it's also gonna help to level out the rest of your body. Okay, today we're gonna be walking you through the process of making orthotics. So, Arian, I'm going to have you step up here onto the foot scanner. Now we're going to ask you to take off your shoes. Yeah. So we have Arian standing on the foot scanner here, and she's going to stand still, and I'm just going to walk her through. We're just going to go through the steps of making orthotics. So first it's going to ask you to scan your right foot, so if you'll move your right foot to the center here, there you go. And if you need to, you can kind of move this other foot. Just stand as you naturally would, okay? And if you'll point the camera down here, we have it scanning her foot. It's going to shoot a red laser beam to determine the depth. And it's also going to shine a bright white light to see what points are touching the screen. Okay, so the dark points are where her foot actually flattens out. So on a normal foot, you would see this. These are light, this is red, so these are the high points and these are the low points. If you look at this right here, you can see when you have one imbalance at your feet, just like in a house, the knees are offset, the axle of the body is going to be turned to one side, and the shoulders are going to be offset, okay? So if you have one foot that sits lower than the other, it's going to throw off the rest of your skeletal structure. Now, if we look over here, you can tell that this person has perfect distribution, and this person's is a little skewed. All the orthotic is going to do, it goes right under the foot, brings it up to the point that it's supposed to be, and it's going to help to level out every other aspect that's hurting you. If you'll follow me this way, I'll show you to our laser treatment area. Okay.
Si nos siguen por aquí, les vamos a enseñar el laser treatment.
Here we have a state-of-the-art laser treatment unit. Now this has been studied at Harvard, and it's the only one in Dayton. Okay, this will help you with tissue regeneration, pain relief, and sometimes even immediate results.
Ayuda con el dolor y ayuda con el dolor de músculos para que se sienta un poco mejor.
Here we have a stim machine. Now this just makes it feels like your muscles twitching while you're under treatment. While you're doing stim treatment, you're going to be laying on a decompression table. Now this rolls underneath you and kind of loosens up the ligaments and muscles that would be under tension while you're standing. This is our ultrasound treatment unit. This sends sound waves into the skin, which cause friction, heating up the tissue at a controlled depth.
Y aquí tenemos la mesa de decompresión.
This is Dr. Petticore. He's our chiropractor.
Él es nuestro doctor Petticore y es nuestro quiropráctico.
Okay, we're just here working on Christopher. He's a patient. So, I'll have you lie down on your face here. Okay, there.
This is our lower lumbar decompression chair.
Esta es la silla de compresión, trabaja en la espalda baja.
Down here.
This is the decompression chair. Now I'm going to have Dr. Petticore, the in-house chiropractor, tell you a few things about this.
All right, this is the decompression chair. It's called a back on track, and what it does is work to separate the vertebrae in the lower part of the spine. What happens is the discs in the lower back, quite often after an injury, they lose their fluid content. The discs are like a sponge, like a thick jelly in between the vertebrae that allow for movement, and they cushion the movement so that it keeps the pressure away from the discs, from the nerves.
Medicine Center at St. Elizabeth's, we offer a full physical activity room. So when you come in here, you're going to notice first, big yellow ball. We use it for certain exercises along with stretches. Here we have our magnetic treatment chair. Each of these pads emits a magnetic frequency, which is going to expedite your healing process.
Esta necesidad magnética lo que hace es aligerar el proceso.
Now, this is Jim, a patient that we've been seeing for roughly 3 weeks, and he's starting to notice almost immediate results. When he's in the chair, he's feeling much better than when he's not in the chair. He was having severe problems with your knee swelling up at night, or throughout the day at least.
Yeah, I was in an auto accident.
Yeah, after an auto accident, seeing raised inflammation in his knee, he started using the magnetic chair and started seeing results, reduced inflammation. Are you able to bend your knee better, Jim? Very cool.
This is a electrical modality that imparts energy into the cells of the body. The body works as a huge battery that needs to be recharged because it constantly works on electrical energy. And what this does is help to recharge those cells by sending a electromagnetic force through the cells that causes a rapid exchange back and forth in those cells to achieve a balance of electrical charges. You have to have the right amount of positive and negative charges in the body for the body to heal and repair properly. This helps with reducing inflammation, reducing pain, actually helps with the body healing itself faster. They've shown cases where actually fractures that are called a non-union fracture, where they're not joining, using this unit they can actually stimulate bone growth. And the same thing happens in soft tissues that are injured. You need to stimulate that growth and repair in the tissues. So this is an important modality as a part of the healing process of what we do here at the Physical Medicine Center.
This is our Vibratrim machine. So the plate that you're going to be standing on will shake you, and it helps to build the smaller muscles through your back. So each time you go side to side, you're trying to support yourself the other way. And you're going to make sure you hold on tight and you go through stretches.
La máquina que tenemos aquí, como pueden ver, hace diferentes tipos de masajes de diferentes ángulos. Lo que hace esta máquina es vibra. Puedes poner tu cuerpo a diferentes ángulos. Es buena para tu espalda, brazos, piernas, muslos.
And we have a piece of equipment here called a Gambale chair. It was developed by a chiropractor, and he works with correcting spinal curves in the neck and the back. And the chair is designed to help to restore those normal curves. When you have, so many people have what's called a forward head posture, where their head is way out in front of their body, and the head weighs about 10 pounds. So if you can imagine a bowling ball on a stick, if you move forward, the muscles at the back have to work really, really hard to hold your head up. So what we want to do is restore that curve so that the head is sitting directly on the neck, on the back. And you also have curves in the lower part of your back. The spine is like a spring. It curves forward and back to absorb shock. And if those curves are gone, then that shock doesn't get absorbed. So let me demonstrate just how this chair works. What you have the patient do is sit down and lie back this way, and this comes underneath the neck, so it's restoring that normal curve in the neck. And then there's a strap that goes just over the head, and all you do is just rest in that position. And there's a thing called plastic deformation, where the ligaments, when they're kept in that position, they actually begin to soften and stretch and regain a normal position. So, with repeated use, eventually the curve becomes restored, and along with chiropractic adjustments and the other therapies that we do, we can restore the normal curves back to the spine, and that allows anything else going on, any other injuries to heal faster. So that is the Gambale chair.
This is our water bed in the physical exercise room. It's going to help your muscles to relax, and it also offers warmth, so that's going to help promote circulation.
La cama que tenemos aquí es una cama de agua, lo que hace que tu cuerpo se relaje y el fluido de sangre sea mejor.
Here at Physical Medicine Center, we don't by any means wish harm on you, but if you're feeling hurt and you stop by, we will do our best to get you back to 100% in no time.
One of the main things I'm really proud of my office is my team. I have a great team. From Dr. Petticord, the training physician, 45 years of experience, 17 years on the board, from Michelle on the front desk to Lisa to Samantha, Daniella, Curticia, Talea, I know I'm forgetting a few, Dalton. I'm very sorry if I forgot a few, but we have a solid team. As soon as you walk in our office, you'll get hit with this infectious, happy attitude, pleasant atmosphere. We picked, we put a lot of thought in our, color schemes, how we, organize the office, and we listen to our patients. I mean, most of our patients come 3 times a week, multiple times a week, and we have valet parking, and things adds up. So you know what, now it's on us. So you don't pay in the front. We took that cost for you, and we constantly open to hear things from small things to to major things. But if I could summarize one thing that we do really well, is convenience. We're located in the main floor of the hospital. There's 200 different doctors with different specialties and backgrounds. We're steps away from, I'll just walk you guys through. Literally, right behind us is the pain management physicians. Across from us is the pharmacy. See, literally, that's the pharmacy, and right behind us is, the pain management physicians, and you can kind of, see it from there, and kind of see that. Upstairs is the orthopedic department and surgery department. Literally, we're like in a medical mall. Few steps. Most of our patients see multiple doctors. You don't have to have your whole day off, just to go see this doctor and go see this doctor. Literally, we're all in one place, a few steps away, and we work together to make it better. And just at the end, if you guys look at all our patient testimonials, you'll see one thing in common, that patients find our office unique, that in our examination, we're very thorough. We have state-of-the-art equipment. And I'm not saying that we could definitely help you, but I'm saying you would never know unless you give us a chance. And thank you for being with us with the virtual tour, and hoping to hear from you soon.